Good morning everyone. I am Dr. Ankit Kalra. I am an interventional cardiologist at Kalra Hospital, Kirtinagar. So today we will have a short session on CKD or chronic kidney disease. So we'll be discussing about what are the causes of CKD and what are the symptoms that patient experiences from CKD and how to treat it and how to detect it early. So what is CKD? So chronic kidney disease is usually associated with pedal edema along with the different symptoms that it gives to the patient. So first see what is chronic kidney disease. So the continuous and permanent damage of the kidneys is known as chronic kidney disease. The kidneys are a vital organ in the body and they have a variety of purposes uh, including the maintenance of the body's mineral and electrolyte balance, assisting in the production of red blood cells, maintaining the acid-base balance of the blood, and excreting water-soluble wastes. Kidneys that have been damaged lose the capacity to execute these functions. There are 5 stages of CKD. In stage 1 CKD, the kidney is normal with more than 90% of the 90% of the kidney functioning properly. In stage 2, the kidney function deteriorates and now the kidneys are functioning from 60 to 89%. In stage 3, it deteriorates further and now the kidney functions usually is about 30 to 59%. In stage 4, it further reduces and now the kidney is functioning only between 15 to 29%, and in stage 5 kidney disease, which is called the end stage renal disease, the kidney only functions about 15%. So since the kidneys compensate for lost function, the signs and symptoms start appearing in the patients and they usually appear late till permanent damage has happened in the kidneys. What are the common symptoms that we usually observe in CKD? First of all, there is swelling of the feet or ankles, which is also called as pedal edema. Then the patient can suffer from nausea or vomiting. There is usually lack of appetite, sleep problems. The patient's urine output decreases. There is diminished mental sharpness. There are muscular cramps, high blood pressure, and shortness of breath. As we looked at the signs and symptoms of CKD, one of the major symptoms which usually irritates the patient is pedal edema or swelling of the feet, that is swollen feet or ankles. So what is pedal edema, how it happens, we will be discussing the mechanism. Pedal edema is swelling of the feet and ankles which is caused by an abnormal buildup of fluid in the ankles, feet and the lower legs. Edema of the foot can be caused by 2 different mechanisms and can happen in unison or separately. So edema forms in patients with CKD due to 2 reasons. First is heavy loss of protein in the urine and second is impaired kidney functions. Nephrotic syndrome is defined as a significant loss of protein in the urine along with edema. A decrease in a protein which is called albumin in the blood results in a reduction of the fluid in the blood. So once this happens, the kidneys then detect a decrease in the blood volume and it starts retaining salt. As a result, fluid collects in the tissue, resulting in edema. But pedal edema can also occur when someone stands or sits in the same posture for an extended period. So the symptoms of the pedal edema include swelling or puffiness of the tissue just beneath the skin. The skin is stretched and appears shiny, and skin that retains a dimple or pits after being pressed for several seconds. So how can we reduce pedal edema in patients with CKD? The treatment of edema includes addressing the underlying cause, lowering the salt intake, and in many cases using a diuretic to eliminate the excessive fluid. It may be beneficial to use compression stockings or to elevate the legs. So to reduce the salt intake, edema can be exacerbated by excessive sodium, which is present in table salts and processed foods. Reducing the salt consumption can help in minimizing edema, especially if you are on a diuretic. Use of diuretics. Diuretics are drugs that induce the kidneys to eliminate more water and salt, hence reducing edema. Because eliminating too much fluid too rapidly can drop blood pressure, it can cause lightheadedness or fainting, and it can further damage the kidney function. Thus, diuretics must be administered with caution. After using a diuretic, you may need to empty your bladder more regularly. However, when diuretics are used at a prescribed dose, other adverse effects are infrequent. Secondly, compression stockings. Compression stockings can be used to prevent and treat leg edema. Although good measuring and fitting of the stockings can limit the risk of discomfort, certain stockings can cause skin irritation or pain, and it is difficult to wear stockings in summers. So, effective compression stockings exert the most pressure at the ankle and progressively decrease pressure up the leg. Fourth is body positioning. Elevating the legs above the level of the heart for 30 minutes, 3 or 4 times a day, can help reduce the leg, ankle, and foot edema. Additionally, elevating one's legs multiple times a day may not be feasible for the individuals who are working. So, lastly, it is not always possible to prevent CKD, but controlling diseases like high blood pressure and diabetes, on the other hand, can benefit. If you are at high risk of CKD, you should get regular testing. Early detection of CKD can aid to slow its progression. Limiting salt intake, choosing foods with low sodium and potassium, and having good physical activity can help reducing pedal edema, which is caused by chronic kidney disease. So, how to prevent CKD and how to delay the progression of CKD? Patient should get tested regularly. Patient should get the KFTs done at an interval of 6 weeks. Any patient who is suffering from diabetes or hypertension, patient should get routine urine testing for 24-hour urine proteinuria or urine protein creatinine ratio. And if patient is suffering from diabetes, it is very essential to use drugs that can prevent the progression of kidney disease, and patient should limit the proteinuria as much as possible by maintaining tight sugar levels. The blood pressure should be controlled strictly. Patient should maintain a blood pressure below 140 to 90 at all the times. Patient should keep a strict control on diabetes by maintaining HbA1c below 6.5, and should get tested regularly with KFT's level, and should monitor blood pressure regularly thrice a day. And there are certain drugs which have been approved by the government authorities to prevent the damage of kidneys in diabetes, especially the SGLT2 inhibitors, dapagliflozin and empagliflozin help in progression of CKD. Then there are certain drugs which help in reducing the proteinuria, such as the ACE inhibitors and the ARBs. Along with that, this patient should reduce the salt intake, patient should exercise regularly, and should see a nephrologist or a cardiologist at regular times, so that patient doesn't go on to dialysis. If the patient takes all the precautions, the kidney disease can be limited. Thank you.